Reading, multiple choice, multiple answers, guided practice. Let's begin. Question number 1, the answers. So let's first read the question. Which of the following is expected of a nurse who wants to provide end-of-life care? The keywords here, nurse, what's expected of her who wants to provide end-of-life care. End-of-life care. That's important. So that means the text is going to be about end-of-life care and what are the expectations from a nurse who provides that end-of-life care. Or the text, it can also be about nurses and nursing in general and the role that they play in providing end-of-life care. Let's quickly skim through the text. The nurse is a vital part. Often is the nurse who has the most interaction with patients. May differ between nurses who specialize in end-of-life care and nurses in other practices. There are a few commonalities. Nurse cannot provide adequate end-of-life care if she or she does not understand what end-of-life care entails, etc., etc. So the way the text is structured talks about the important role of nurses and then says that the nurses who provide general care or in other practice areas and the ones who provide end-of-life care, there are different roles and different expectations from them, different tasks that they have to do. Of course, there are some similarities, but there are also differences. And now, each of these options is supposed to represent one expectation from the nurse who wants to provide or who provides end-of-life care, and we have to validate that against what's there in the text. A good nurse will have effective communication skills in order to develop a good nurse-patient relationship. So let's see where this is written. Communication skills. Good. Yeah, it's the nurse who has the most interaction with patients and as a result can establish a good nurse-patient relationship, but doesn't mean that to establish a good nurse-patient relationship, the nurse needs to have good communication skills. And also it's nowhere mentioned that the need to establish a good nurse-patient relationship. It is specific to the nurses who want to provide end-of-life care. So not an option for us. The next, a good nurse will have the knowledge to care for patients living with a serious illness. Yeah, this is here. This includes arming oneself with the knowledge required to provide care to patients who are living with a serious illness or injury. So that it means this includes arming oneself or getting the knowledge or having the knowledge to care for patients living with a serious illness. So a correct option. Now spend a few seconds, spend a minute and try to understand why this other option is correct and why the rest of the options are not the correct options for us. You can pause the video, try to do this on your own. The next question now. The answers. Let's begin with reading the question as always. Which of the following are reasons for why lectures are criticized as a teaching method? So that means the question is that why lectures are criticized as a teaching method. So the text will have a discussion about maybe different teaching methods or about lectures. The text might entirely focus on lectures as a teaching method and then discuss some good things about them and some bad things about them. So we have to identify the criticism, that why they're criticized as a teaching method. And each of these options, they are supposed to represent one reason for why lectures are criticized. Are criticized means are considered a bad teaching method. So out of these, we have to pick the options which are correct, which are valid criticisms as per the text. Now let's skim through the text. Though lectures are much criticized, universities have not yet found practical alternative teaching methods. Critics point out that lecturing is merely a one-way, does not involve audience participation. Contrasted to active learning, lectures have a significant role outside the classroom as well. Scientific awards routinely include a lecture, etc., etc. All right. So, yeah, this is a discussion entirely about lectures and begins by acknowledging that they are criticized as a teaching method. And the second paragraph, it talks mainly about the role outside the classroom. But I think we need to focus specifically on the role in the classrooms and as a teaching method. So, for example, here, the public lecture has a long history in the sciences and in social movements. So churches, community centers, these don't really concern us because we are focusing on lectures in a teaching environment that is inside the classroom. So lectures by talented speakers can shift the students' focus from lectures lecture to the speaking style of the speaker. So is there a mention about talented speakers or the speaking style? Yeah, lectures delivered by talented speakers can be highly stimulating. Yeah, it just says that. It doesn't say that because of the style of the talented speakers, the focus shifts away from the lecture and rather on the style of the speaker. So this is not correct. We won't select this option. So see, again, this is an example why you should not be in a hurry and you should not just do blind keyword matching. So if you just look at talented speakers, you might think, yeah, this option matches, but you have to properly understand it. Let's look at this one. Lectures are considered a one-way transmission of information from speaker to the listener. And if you go here, then it's correct. Critics point out that lecturing is a one-way method of communication, does not involve significant audience participation, relies upon passive learning. So that's a valid criticism. So I select that option. Now it's your turn. Find out the reason why this is correct and why the other options we have not picked up. Now let's go to the third question in the practice session. The question, the answers. So what the question is, which of the following factors determine the extent of withdrawal symptoms? So the text is about withdrawal symptoms, and a part of that will talk about the extent of withdrawal symptoms, that how strong the symptoms are, how long they last, etc. And each of these options is supposed to represent one factor that determines the extent of withdrawal symptoms. And that's what we need to validate against the information in the text. So let's quickly skim through. Physical dependence can develop from low dose therapeutic use of certain medications as well as recreational. The higher the dose, the greater the duration, and the earlier age use began are predictive of worsened physical dependence and thus more severe withdrawal symptoms. So this part, yeah, it's talking about, has mentioned a few things that decide how severe the symptoms are going to be. Can last days, protracted, also known as is a low-grade continuation, often resulting in relapse. Can last for months, is noted to be most often caused by benzodiazepines. To dispel the popular misassociation with addiction, is sometimes compared to dependence on insulin by persons with diabetes. So, yeah, the first part, this talks about the factors that determine the extent. So maybe this is where we will focus on when we validate these options. So dosage of the drug use, the higher the dose used. So the dosage of the drug use determines the extent of the symptoms. So correct option. Duration for which the drug was taken, the greater the duration of use. So again, validated. This option, period for which drug was taken without break. I think, it mentions the duration, but it doesn't mention any specific sentence that for how long the drug was taken without a break. Nothing is that specific in this text. So that's why we won't pick this option. Okay, now why do you think this is the correct option? Age, and why do you think these others are not correct? So spend a few minutes, try to understand that. Just follow the same rules that we've been following in all the previous questions. The final question in this practice session now. The answers. The question, which of the following statements about nights are true as per the passage? So each of these options is supposed to be a statement, is supposed to be a fact about nights, and we have to find which of them are true as per the passage. So let's quickly skip through the passage first. In the early medieval period, any well-equipped horseman could be described as a knight. The first knights appeared during the reign. The Franks were generally on the attack, and a large number of warriors took to their horses to ride with the emperor. The Franks increasingly remained on horseback to fight on the battlefield as true cavalry rather than mounted infantry. Although in some nations, the knight returned to foot combat in the association of knight with mounted combat remains a strong one, etc. These mobile, moderate warriors made far-flung conquest possible, etc., etc. So the option, we have to validate each of these options one by one. And by skimming, we have understood the structure that, what was a knight in the early medieval period? Well-equipped horsemen. And then the paragraph tells a few statements about them. And then the second paragraph also how they played a role in far-flung conquest, etc. Now let's look at these options one by one. It was a term used to describe the very best horsemen in the early medieval period. There is a statement like that, but it only says that early medieval period, any well-equipped horseman could be described as a knight. So not just that the very best horseman was described as a knight. So that's why this is not true. We are looking for true statements. Knighthood ceremonies involved giving weapons and declaring them as knights. So is there any mention of a ceremony or a celebration or an award, something like that? Yeah. Ceremonies. Presenting a young man with weapons influenced the emergence of knighthood ceremonies in which a noble would be ritually given weapons and declared to be a knight, usually amid some festivities. So yeah, that's a correct option. Now your turn. Figure out why the other three options are wrong and why this option is correct. All right. After this, that's the end of our guided practice session. Spend plenty of time in the test software going through more practice questions on your own. And I always say that if you spend 30 minutes on practice, make sure you spend at least 10 or 15 minutes going through the results. So trying to understand that why a question is correct, why the option is correct, and why some option is wrong. This is not maths and science that you just see a correct option and you'll remember it. And then in the exam, you'll reproduce as it is. In the exam, you will have the same concepts will apply, but usually there'll be different questions. So that's why it's important to understand the concepts. So spend some time reviewing your responses and making sure that any question that you have not been able to answer correctly, you should understand the reason for that.